So coming back to these Boardwalk trays, these Boardwalk trays are great. If you look back in the distal section of that tray, it's got a little flange there, which helps to increase the hydraulic forces to force the material upward in your prep. And we get the hammer and notches in our impressions too, and some of us will actually use the indentations of the hammer and notches to help us mount the models. If you look at the bottom, there are yellow trays and red trays, and those are heat wave trays. And those heat wave trays we can shape. So if you get the patient with maybe a very broad arch or maybe a very narrow arch, these trays come in many different sizes, round, square, Gothic arch, which is kind of a very V-shaped form. But if those trays don't fit well, then what we can do is we can warm up some water, soak the heat wave tray in that warmed water at about 158 degrees Fahrenheit or 70 degrees Celsius for 60 seconds, and actually mold the tray, bend out the flanges, push them in, whatever needs to be done, run that under a little cool water, let it cool, and it is nice and rigid once again. The way these trays work is there's these little calipers that you see over here on the left-hand side, and you put those calipers for the upper arch on the buccal of the molar area and on the lower arch on the lingual of the molar area, carry that measurement to the chart, and it basically determines what size tray you use, like 44 or 53, whatever size is right. So what we did in this Typodon is we took the calipers, we set it up on the mandibular arch on the lingual of the posterior area, took it to the chart, and the chart said try the 54 size tray, and that's what we used. So the 54 size tray fit in our Typodon's mouth really well. Now, even though these are Boardwalk, what you want to do is you want to make sure that the material doesn't pull out of the tray. You know, in previous years, what we would do is we would take an impression, and if the lab needed 2 impressions, we'd take 2 separate impressions. But today, with great polyvinyl siloxane materials that we have, many times the lab will get 1 good impression, and from that they may make 2 or 3 different models. And so they've got, say, a good impression. They pour it up once, but when they separate the stone from the PVS material may pull away from the tray. So using something like the Affinity tray adhesive helps to maintain the PVS in the tray. So again, something that I would recommend is a tray adhesive. Before we take our impression, there is a pre-impression cleansing gel called Detail from Clinician Choice, which is basically 10% EDTA cleanser. And we use this today. Right before I came on to this webinar, the patient that we had, we did veneer preparation. And before we took the impression, for 7 to 10 seconds, we just scrubbed the detail into the prep. So just removed all the debris on all the contaminants. We rinsed that off. It lowers the surface tension, and we got a great impression the very first time. So here's a case where back on the Typodon, we may use that detail just to clean the prep. We just scrubbed that really, really well. Depending on your technique of your impression, there is probably an affinity impression material from Clinician's Choice that fits your technique. And so today in our office, we were doing single units and we were doing multiple units, and we found a material in the affinity line that worked really, really well. So find the proper impression material for your technique, the proper viscosity, and the proper set time.